Talofa lava, my name is Dr. Neru Leavasa. I'm the local MP for Takanani, representing the Labour Party, and I'm Samoan. Mum from Leavasa Solo and Dad's from Waiala, Waimoso.
What's your favourite spread and what does that say about you?
I love my Marmite chip sandwich. I love a bit of crunch from the chips, but the Marmite with that specific taste. I can't do Vegemite, Kiwi as, still Samoan hardcore.
What are the bread and butter issues you think Pacific voters are most concerned about, and how will you address those?
So the current bread and butter issues is our cost of living. The priority is to make sure that we're supporting our young Pacific families, especially across Aotearoa. We have a young population in Pacifica, so when it comes to ECE, extending the 20 hours free to our 2-year-olds. When it comes to public transport, having it free for our under 13s, and then half price for our students up to 25 years old. And many other health policies, such as the $5 prescription and getting scrapped, helping many of our Pacific families that do go and see their health professionals, and that's one of the barriers.
What is your why? What drives you?
My why would be an acknowledgement from my mum and dad and my upbringing, because they were always about family, they were always about community service. Mum was a healthcare assistant for Spectrum Care. My dad was a security guard. Both hardworking, good Samoan values as well. My dad was a chief, so he was always supporting the wider family in the village as well. So growing up in that setting, service was always important to us. I did suffer as a young kid. I did go through cancer. I had bone cancer, I had lung cancer as a teenager. When I came out of that sort of health scare, number one was the faith that we had as a family and as a church, and then looking to where I can serve. I've spent a decade and a half in South Auckland serving as a medical doctor, as a GP, and also as a sports doctor. And I've always seen the issues that come through the clinic doors, issues related to poverty, poor housing, poor employment, those social issues that really had an effect on people's health and well-being. So being a doctor, you can only do so much, but I always wanted to advocate on wider issues that was really causing the problems with health. So that's when I stepped out of the clinic doors, started doing community work, or setting up a couple of charitable trusts for health and well-being, and then put my hand up for local government. I got elected as a local board member, and then in 2020 ran for Takanani. So I was pretty blessed to get the vote for Takanani, and been serving as a local MP for the last 3 years has been a huge privilege and honour. And I always make sure that I thank the Lord first. I wouldn't be here without God positioning me and helping me, healing me, and also looking after my family. So service has always been a key factor in faith as well.
How are you feeling about your upcoming election race and your opponents?
Yeah, I'm pretty optimistic, but I know it's going to be a huge challenge. So we're still fighting hard, and I just hope the community sees our track record and just make sure that they support me on the day.